Oral cavity. Remember that oral cavity is different from throat in ENT, so you will begin the command to either examine the oral cavity or you're going to command to examine the throat. So both are different examinations, so we are going to do oral cavity in this examination. In inspection, the first thing you're going to do is examine the borders of the mouth. You're going to look for any scar mark. You're going to look for any cleft lip history. You're going to look for any angular stomatitis, and you're going to look for the angle of the mouth. Ask the patient to clench his teeth. As usual, you're going to look for the facial nerve, whether it's functioning or not, the marginal mandibular nerve. Then you're going to examine the teeth, whether they are aligned or not. Then you're going to take a tongue depressor and you're simply going to examine the inner surface of the lip. You're going to examine the buccogingival groove and you're going to examine the gingiva. Then you're going to examine the upper inner surface of the lip. You're going to examine the gingiva and you're going to examine the buccogingival groove. Then you're going to examine the buccal mucosas on both the side. Then you're going to give a journal look to the teeth, mukhole, and to the tongue. You're going to look for the tongue for different diseases. You're going to ask the patient to take the tongue out. You're going to look for any fasciculations. You're going to look for any deviations or any scar mark on the tongue. Then you're going to ask the patient to take the tongue up, and you're going to look for the sublingual area. You're going to look for any swelling, any scar mark, or any discoloration. Then you're going to put a tongue depressor and simply examine the oropharynx. You're going to ask the patient to do kare. Although we are using a single tongue depressor, but in the undergraduate level you will be provided one tongue depressor, so you are going to do it with single tongue depressor. In the postgraduate level, we usually prefer two tongue depressors for the examination of the oral cavity. The other tongue depressor is put on this side and we open the buccal mucosa and we'll examine the oral cavity completely. Now this is the inspection part. After this we proceed with the palpation part. Now the palpation part of the oral cavity is very much different from the other parts. In this you have to put gloves, you should have a pair of sterile gloves. Then we are going to proceed to bimanual palpation. Palpation in oral cavity is called as bimanual palpation. For bimanual palpation, you will have to ask the patient to open his mouth, mukh khole, and then you are simply going to press against the Stenson duct and massage the parotid duct from outside, the parotid gland from outside, and you are going to look for any secretions. This is called as bimanual palpation, or you are using both fingers of the hands. Then you are going to simply going to put your finger over here and simply palpate the submandibular gland from below, and you are going to look for any secretions or discharge coming out from the Wharton duct. Under normal situations, there will be no fluid oozing out from the Stenson duct or the Wharton duct. After that, then you might begin the command to check the taste sensations.